Erythrocyte sedimentation rate, the rate at which the erythrocytes settle down. Normally, the red blood cells remain suspended uniformly in circulation, called suspension stability of RBCs. If blood mixes with an anticoagulant and allowed to stand on a vertical tube, the red cell settle down due to gravity. There are two different methods for determination of ESR. One is Westergren method and second one Winthrop method. Depending on type of instrument it used. In Westergren method, Westergren tube and pipette are used, and Winthrop method, Winthrop tube and Winthrop stand are used. Normal value in both type of method by Westergren method in male 3 to 9 millimeter per hour or at the end of 1 hour. In female 5 to 12 millimeter at the end of 1 hour. In infant 0 to 2 millimeter. In Winthrop method in male 2 to 4 mm at the end of 1 hour. In infant it is 0 to 5 mm at the end of 1 hour. Three stages of sedimentation. Whole process take near about 1 hour. There are three stages: stage of aggregation, stage of rapid sedimentation, and stage of steady packing. In aggregation, red cell pile up and form rollets that become heavier during the first 10 minutes. In rapid sedimentation, rollets being heavier sink to the bottom, taking up to 40 minutes. In last steady packing, there is packing of masses bunches of red cells at the bottom of blood column takes 10 to 12 minutes. Factor influencing ESR, specific gravity of red blood cell is directly proportional to erythrocyte sedimentation rate. Viscosity of blood, viscosity offer more resistance for settling of red blood cell. That's why if viscosity is increased, then ESR is decreased. Number of cell, when RBC increases, the viscosity of blood also increases and it results into decrease in erythrocyte sedimentation rate. Shape of cell, biconcave shape favor Rolex formation. That's why it increases erythrocyte sedimentation rate. Tendency towards spherical shape result into decrease in erythrocyte sedimentation rate. Size of cell, increase size, there is an increase in erythrocyte sedimentation. Physiological variations. According to age, in newborn erythrocyte sedimentation rate is low and in old age it is increases. As per gender, erythrocyte sedimentation rate high in female as compared to male due to number of red blood cells. In pregnancy, erythrocyte sedimentation rate is increased during the pregnancy due to hemodilution and increased fibrinogen. In temperature affect erythrocyte sedimentation rate due to alteration in viscosity. Erythrocyte is increased in some pathologic condition associated with inflammation and tissue damage. These are some conditions of related to inflammation and tissue damage, that is acute and chronic infection like pneumonia, TB. All type of anemia except spherocytosis, sickle cell anemia, and pernicious anemia. Osteomyelitis, rheumatoid arthritis, gout, trauma, surgery, any large scale injury, and chronic renal failure. ESR is decrease in polycythemia vera, sickle cell anemia, congestive heart failure, or fibrinogenemia, allergic condition like whooping cough, and dehydration. Clinical significance of erythrocyte sedimentation rate. Erythrocyte sedimentation is in an easy and inexpensive and non-specific test which is useful in diagnosis as well as prognosis. It is non-specific because it cannot indicate the exact cause or location of disease but help to confirm the diagnosis. In prognostic, monitoring the course of disease and response of the patient to the therapy. Erythrocyte in diagnosis to distinguish functional from organic disease. In acute rheumatoid arthritis, in myocardial infection, in depressant stomach cancer from peptic ulcer, it is raised in pelvic inflammation and not in the rupture to gestation. Erythrocyte in prognosis and treatment. In fever, a raised ESR suggests progress of disease. In rheumatoid fever, its special index of persistent rheumatic infection. In coronary thrombosis, repeated determinations serve as a guide of treating and in management of patient activity. In acute nephritis, the grade remain high in patient passing into chronic. Determination of erythrocyte sedimentation rate. Principal band is erythrocytes remain uniformly suspended in the plasma of circulating blood, but when blood is taken out of body and mixed with an anticoagulant and kept in a vertical tube due to their high specific gravity than plasma, erythrocytes sediment gradually toward the bottom of the vertical tube. The rate at which the erythrocyte sediment is then recorded in millimeter at the end of 1 hour. This is erythrocyte sedimentation rate. Instrument or apparatus required for this method: disposable syringe with needle, sterile cotton swab moist with 70% of alcohol, 3.8 sodium citrate, tourniquet, graduated Westergren tube, ESR stand, tourniquet, and stopwatch is needed. Procedure for ESR by Westergren method: under all aseptic precaution by venipuncture, take 2 ml of blood, transfer it in bulb containing 0.5 ml of 3.8% sodium citrate and mix well. Fill the Westergren tube by sucking off to the mark 0 at the top side. While sucking through Westergren tube to control the blood flow, partially close the tube with index finger. Then carefully put the filled tube on the pad of Westergren stand. While putting the tube, your index finger must be tightly pressed on Westergren tube to avoid blood leakage from bottom side. Firmly press the bottom side of tube on the pad of Westergren stand. Then slip the upper end of tube under the screw cap of stand and note the time. Wait for an hour and then take reading of clear plasma. You will see the settled erythrocyte below the plasma. Observation: you can observe clear plasma. Precaution should be taken. Do not shake the anticoagulant and blood for mixing. It may cause froth as well as it may be ruptured erythrocyte and reading will be false. Check the ESR within 2 to 3 hours after collection of blood. Pipetting should be with proper care. Confirm that no leakage at the pad of stand. Do not